Hello, my name is Dr. Hilary Bekker. I'm a psychologist and an associate professor at the University of Leeds. For the last 10 years, I've led research with a team, a multidisciplinary team of health professionals, patients, decision scientists, health services researchers and health informatics colleagues called the Yorkshire Dialysis Decision Aid team. And over the last 10 years, we have looked at how patients make decisions about dialysis and looked at the adequacy of information to support people making decisions actively between treatment options. And also we have developed a patient decision aid, which is an evidence-based resource designed explicitly to help people make sense of both the information provided about dialysis options and how they can use that information and evaluate it in accordance with their own values to reach an informed preference about dialysis that they can use within pre-dialysis consultations to make a collaborative decision with health professionals about the dialysis options that suit them. One of the products from our research is the Dialysis Decision Aid booklet. This is currently hosted by Kidney Research UK and can be accessed freely via their website, and it is recommended best practice by the European Renal Best Practice Association, the International Peritoneal Dialysis Society, the National Institute of Clinical Excellence, as best practice to support the education of patients about dialysis options. The reason that this booklet is different from a lot of the information out there is that it's actually designed to help break down the decision into evidence-based information about the options and their consequences. It's designed, the facts are written in such a way that patients can make sense of the information in the context of their worsening kidney disease state. There are sufficient prompts within the resource to help people actually see the decision, so they can see how their disease is progressing from chronic kidney disease to established kidney disease. They can see the decision points as they go down, and then the information then talks to those decision points. The information is structured in such a way to allow people to process it more easily. Most information that we see provided within health services is presented sequentially. So you get option A presented by option B. Actually, as human beings, we're quite lazy when we look at information, and we will either remember the first bit of the first information or the last bit of the last information, and the bit in the middle gets lost. What we do within decision aids is we present the information in parallel. This helps in a number of different ways to at least get people to engage with more of the information and to make a representation of the decision in their heads that they can then fill up, make little categories, and they can fill it up with all the information they get, but it creates more of a representation. Part of that is presenting the information in parallel, so you can actually see the four options, which is peritoneal dialysis and hemodialysis, presented in hospital or at home, or automated or continuous ambulatory. So there are four options, and people then can represent those four options. We also structure the information in accordance with what we know about how people make sense of illness. So the facts are presented in a way that fits in with people's schemas, people's way of making sense of the illness, which is different to just the pros and cons and the advantages and disadvantages of treatment. It includes those facts, but actually it's presented in a way that fits in with how people make sense of illness. So it's easier to process. So although the information is often more than the routine leaflets that are given out in clinic, it's actually easier to process. So people stand more chance of looking at it and more chance evaluating it with their own beliefs. It has a number of prompts within the resource to help people think about their lifestyle, and think about what they like to do within their lifestyle, and then to go back to the information that's been given to them about the dialysis options and think about how they might squeeze that into their lives so they can still carry on doing what they want to do. So it It takes the treatment options out of the clinical context and puts them back into their life. And then it encourages people to think about each of the options and rate how likely that option would fit into their life, which then provides a starting point to help people have that conversation with the pre-dialysis team and work together on implementing the preferred choice, or looking at the way the service can help support them, provide the additional information needed to manage the chronic kidney disease once the decision has been made. 97% of the participants in the study said they read the decision aid, and 76% of them showed it to a family member, and indeed we found some evidence that they started talking more to their families about the decision and how it would work at home. 66% of people read the information more than once, which is what we wanted them to do, to have it at home and to refer to it. And 23% said they'd already started writing notes in it, which is an incredibly useful way of personalising the information and helping the health professional personalise the information as they move from consultation to consultation. Since September, Kidney Research UK have been monitoring both the patient and professionals' use of the decision aid in practice. Is this something that was just, a good rigorous study, or was it something that had a pragmatic application? And actually the comments that we're receiving from both patients and professionals is that it is the most patient-friendly resource they've ever come across. Each month we're getting more and more practices adopting this as the usual care information they want to deliver to their services. So I think currently we have 10 services in the UK that have bulk ordered the decision aid to use with their education programs, because it fits in very well with the different ways services deliver their pre-dialysis care. There is now an international agreement so that if an organisation, a country wants to translate it for use in their countries, then they work in partnership with Kidney Research UK and myself to translate it and keep its integrity as a decision aid, but for the language that the country needs, and perhaps some of the individual differences within countries, to make sure that we keep the integrity of a decision aid resource. One of the purposes when we were designing this decision aid was to make it as generic as possible. So it didn't matter what people's experiences were of kidney disease, or of their prior experiences of treatments, or whether or not they were a carer or a patient or a health professional. It was explicitly designed to be as accessible to anybody as possible. So it's written in a way that is in the third person, really, so people don't feel it does or it doesn't apply to them. They can evaluate it as they want. Also, it doesn't matter how much experience they have of dialysis, whether they've had dialysis before and have gone into a transplant. We provide a sort of a basic evidence-based information about the 4 treatment options and what that entails. Currently we haven't specified or made it specific to switching from one type of dialysis to another, but certainly as a basic grounding in all the treatment options, dialysis options, it provides a kind of a basic non-directive grounding for the information. And a lot of the switching decisions really need to take place between the pre-dialysis team and the patient to talk through the individual differences depending on somebody's treatment and the efficacy depending on their prior conditions. And very much that is a shared decision, very personalised decision based on a set of details within a consultation. And you, in some senses, you can't really put that all into one decision aid that is generic for everybody. So it's about thinking about what do people need to help them structure and represent the problem so they can go in with the right set of questions. And that's what this decision aid does. It provides that representation of the information, the decision, the prompts to ask the right questions about their condition, about their lifestyle that may impact on their decision. One of the difficulties we found when we were talking with the pre-dialysis teams was for them to make a decision about what information needed to be told at what point. And there was a tendency to talk about everything all at the same time when somebody is moving from chronic kidney disease to established kidney failure. And in some senses what this booklet does is it helps chunk the order of the information and separate what is needed to be spoken about to help make the decision versus help manage the chronic kidney disease. And in fact, it's the health professionals have found that a very useful way for thinking about how they deliver the education within the consultation. So for example, we break down the decision into the first decision point is actually talking about the options between conservative care and kidney replacement therapy as the first decision point, which helps the team separate that first decision. Do you want to think about having a dialysis option at all, or do you want to think about conservative care? And then breaking it down to, okay, so now that you've chosen or you know that you want to explore dialysis as an option, there are 4 dialysis options we offer as a service. And it has helped the teams order the information in a way and chunk it so that it helps make the decision rather than the self-management or what needs to be changed immediately, which needs to be told, but not necessarily at that first point when people are trying to represent the decision and understand what the decision is for them. Very often when people have chronic kidney disease, they're used to monitoring or managing their kidney disease, and they're used to the pattern of the relationship with their pre-dialysis team, and in fact they're very satisfied with the care given by their pre-dialysis team. The problem is actually figuring out what the decision is and how they can engage with that decision, and understanding that it's their responsibility to make. Well, they know it's their responsibility to make, but how to go about making the decision, and this decision aid helps people navigate through that process.